Good morning, everyone. Good morning, everyone. My name is Dr. Ravi Gadani. I work as assistant professor. Yes, sir. Absolutely. Any pehla actually. So we'll talk about literature search. So far in today what you saw what this program was all about and how to find research questions, how to frame research questions, what are aims, what are objectives, what is PICO, PICO, etc. So now once you have the question reasonably ready, or at least the field reasonably ready, now there is a time to search for relevant literature. This is not writing of review of literature. Writing of review of literature is the next session after the lunch. This is about just searching, gathering the pool of data that you then want to generate your literature review from. So the objectives of this session is, of course, you will come to know what are the authentic and non-authentic sources of data. You would also be able to guide your PG student, how to search for relevant literature, and finally to learn to navigate databases, especially PubMed. So PubMed is the demonstration, or how to navigate through PubMed is the main core part of my session. The agenda is we will first see what are scholarly sources of data and what are non-scholarly sources of data. We will also then see what is the evidence hierarchy. We will see how a search question is formulated, which you have just seen, so we will just brush through it. And finally, there will be a large demonstration of what is PubMed and what are other useful platforms. So when I say what is a scholarly source, કોઈ પણ ઇન્ફોર્મેશન હોય એનો સોર્સ જે છે એ સ્કોલરલી છે કે નહીં, how do we define it? Like when would you say that it is a scholarly source or it is not a scholarly source? It is from a textbook. So textbook is a very valid scholarly source. Anything else? So subject specific journals, especially established journals or credible journals.
Manuals, WHO manuals or NC?
Yes. So manuals or guidelines are, yes, so which are published by a authorized body. That is what we would call a scholarly source. So essentially it is usually written by academics or experts in the field. They have a skin in the game. They are not people who are like into, have just cursory knowledge of anything. So they are written by academics or scholars. The intention of publishing it, like putting it in the journal or on the textbook, is to spread the knowledge and advance the science. And that is how scientific advancement happens. So most journals are considered as scholarly sources. So now within scholarly sources, now we know that there are scholarly sources. There are three types, other types, another method to differentiate the sources. So they are known as primary, secondary and tertiary sources. What are primary sources? Can anyone tell me what is a primary source? No, textbook is not a primary source. So which are the
specifically to the subject.
So what are, okay, let me rephrase the question so that it makes it clearer. So consider I have two articles. Okay, so one article is about maybe safety of laparoscopic hernia surgery versus open hernia surgery. I'm a surgeon, so the examples will veer towards surgery. So that one article talks about 100 cases in each arm, 100 cases of open surgery versus 100 cases of laparoscopic hernia surgery. So this is one article and they talk about everything, maybe this is how it all happened. So there's another article whereby they have gathered on the same topic, such 5 or 7 articles and they are reviewing it. Am I making sense? So in the first article, I only have done those 200 surgeries and I am publishing it or sending it for publication. Versus the second article where what I am doing is I am collecting 5 articles on the same topic and I am critiquing it. So that is secondary. So primary sources are original reports or discoveries and they explain the method in detail. This is what I did. So that when the secondary people walk in, they have everything that they can judge my article properly, right? So they have the main distinguishing feature is it has methods and they are factual in nature. The secondary sources are usually analysis of the primary sources. They are meant for context setting. So consider I find something that works here, but somebody from Africa may say that by that works in your area. It is region specific. It does not work on mine. It does not lower the validity of my study, but they are setting the context that whatever you are saying may have some geographical limit. So it is interpretive in nature. So primary are factual, secondaries are interpretive, tertiary are usually textbooks. These are the knowledges that are proven. They are now beyond doubt. So by and large textbook, because whatever enters textbook has been filtered through numerous sources, right? So this is the main difference. Now there is a list of sources. So we saw that what is scholarly source. And then we saw what are primary, secondary and tertiary. Now I'll just list few sources. You want to tell me if each one of them is, would you consider each one of them as scholarly source or not? Okay. So we begin by Google search. It's a scholarly source or not a scholarly source? So it is not a scholarly source. Wikipedia? No. Why Wikipedia is not a scholarly source? So it is editable, right? It is, anybody can edit it. In fact, there was people used to believe that WIKI, Wikipedia, the same way there is something known as Wikictionary, there is something known as Wikitravel, right? So WIKI is a common part. So what does WIKI stand for? What I know is. What I know is. So most people believe that wiki means this. So you can also create your own wikis. Okay? But actually it means wiki is actually a Hawaiian word which means quick. Anyways, published journal article, of course credible. Government publications, they go through a lot of it. Newspaper articles, no. Right? Blogs are no. So blogs are something that would be fetched if you search on Google. So now Google search, if you do broad, it may also fetch some articles which are credible. But you cannot rely on them because there will be a lot of noise in the signal. Textbook is of course, yes, Google Scholar is a credible source. Okay? Government published guidelines, participant, they are not credible, which are just random notes. You may not be able to, because it can be context specific. So these are...
This article are shown to be taken with the...
So that is exactly what I said when madam said that we need to have the journal per se to be credible.
Yeah.
Right? The journal need to be credible. Otherwise, right now the predatory journals are breeding at all places. Yes, so then we can always talk about how to judge a journal. But yes, of course, like if it's a National Association kind of journal, so you may say that this is probably credible. Now there is something known as evidence hierarchy. We all know of evidence hierarchy. We talked about what is scholarly. We talked about what is primary, secondary, tertiary. We talked about which are the sources of scholarly material. Now when I get a particular source, consider I get an article on the same topic. Let's talk about prevalence of hypertension amongst all the diabetic patients. Let's talk about that. Keep it simple. So consider I get an article whereby what they did is they saw all the patients of, they just saw through the database of all the diabetic patients, and then they saw in how many was hypertension present. So kind of a case control study probably, versus somebody has done an actual RCT. So which one would you give more weight to? RCT, right? So you also know. Now consider there is someone, on a coffee table conversation at some place, some people are discussing that, what happens because of mobile screen. I know that in children refractory errors are increasing. Two people are just talking about it. That I believe that because of use of mobile or tablet, the refractory errors among children are increasing. What would be the level of evidence here? It will be very low, because it is personal opinion, expert opinion, personal judgments, etc. Right? Because it's not published. Just a sec. Yeah. So we have something which is established as evidence pyramid, whereby we know that what to give, what amount of weightage. Okay. So because medicine, the modern medicine is based on evidence. Yes, sir.
Tobacco in Parkinson. All studies are done under the effect of the tobacco lobby. So whatever is evidence-based generated document also is not always reliable. એટલે એક wisdomની વાત આવે છે ને, that must be respected, and that's a we have to keep in mind.
Yeah, definitely. So I believe that in the kind of world that we are living in, the kind of complexities that we deal with, we have to take everything with a pinch of salt sometimes and maybe add some wisdom to it. You are right. Secondly, lived experiences can never be, lived experiences, we cannot negate their importance. When we say that there is evidence hierarchy, it is more likely that if you want to conduct a new study, and if I want to use some other literature as quote, in discussion part of my study, to compare my study with, at those times, I will require them to be coming from credible sources, right? So evidence hierarchy, evidence-based medicine is the foundation of current practice. So that is why if evidence is so important, like before a patient walks to me in the OPD and he says that I have gallbladder stones, before I tell him that you require cholecystectomy, I need to have enough evidence behind me. Like it has to be there in the journals earlier, then it later entered the textbooks. So now I am safe that when I say that you require cholecystectomy. So evidence pyramid actually is the hierarchy of evidence, and that is why it is foundation of EBM. It guides us about the credibility of evidence. So as I said, that background information or expert opinions, they come as the lowest rung. Yes, sir. Yes, please, sir. Yes.
Yeah, we want to learn.
Yes.
આજે વાત કરી કે પહેલા પાસમાં સ્ટડી થાય છે કેમ લેપ્ટોસ્પાઇરોસિસમાં we have written the history. In the world we have written the history. અને ટ્રીટમેન્ટ ઓફ લોકલ કટ્સ એન્ડ વુન્ડ્સ and oral oxygen literature ક્યાંય નથી. We started for the first time in the world, and now there are 0 patients. So there are some scientific teachers, RDT, medical directors, they are opposing. But we applied and now we want. So every time when we are writing, when you are approaching for the first time anything in world, you have to take the leadership.
But then it is published or no?
Yes, sir.
So others will take like
Yeah,
guidance from your-
the other part of the country now it's in the national guidelines.
If it is a published hierarchy,
No, when we start for the first time, the objection આવે છે મારી પાસે.
નઈ ચીજ તો
એ વખતે કઈ ટ્રીટમેન્ટ કરતા ગવાના હોય.
પેન્ડેમિક કે એપિડેમિક હોય ત્યારે પછી
નહીં, આ તો એન્ડેમિક 18-20 વર્ષનો રોગ. 18-20 વર્ષના રોગમાં રેઝિસ્ટન્સ આવે છે.
Right.
That we have to fight.
So I think I'll clarify what sir has just said, and it's a very valid point that any new thing will always come as a thought first, a probability that maybe there's this connection, and that thought would birth only at the end of certain amount of practice in that field. Otherwise it would not come, right? A newbie may not think of doing, but because you have soaked yourself in a particular field for long enough, you may think of something. Now
માસ્ટરગીરી કરે 4 ગ્રામ કામ કરો તો બેમાં આપણે પેસેબો રાખીને બેમાં આપણે ટ્રીટમેન્ટ કટમાં પેલું બીટાડીન લગાવવાની. મેં કહું આપણા છોકરાને વાગ્યો તો બીટાડીન માટે ટ્રાય કરવા જઈએ તો કે ના પેલું શાંતિ રાખો દર્દી બચાવવાના છે ત્યારે માને.
right, so but sir, I would like to place it in a context in a way that if you see there are 1000 people giving opinions on something, now of course there would be 50 who would be credible. But if we see 1000 published articles, then the chances that 900 are credible would be more, right? I mean, it of course would go like that. So definitely everything always comes first as an idea, then we execute in a small, then we go to case control, then cohort, then RCT, and then maybe gets published, something like that. So I think, but nonetheless, in the evidence hierarchy, it still holds the bottom part. A lot of physicians, surgeons, orthopedists, everyone, a lot of us, we have some practices which are not published, but we know that we have seen results. But if we really want them to get established as truths, then they have to pass through certain journey of publication. The second part is, as I said, case series and reports, which are series, because I saw 5 cases or 10 cases or 50 cases, or reports which are isolated and then they can be clubbed together from all over the world, and then that is followed by case control studies. So if you see up to background information, expert opinion, case series, there is no method, right? It is case control when method starts to emerge. These are then followed by cohort studies. Case control studies go from outcome to exposure. So they are usually retrospective, and cohort goes from exposure to outcome, right? And then what would come higher than this? Randomized control trial. RCTs are, as of now, gold standard for especially new drug discoveries and assessment of those drugs. Now, RCT is the highest level of primary literature, because till RCT, we are doing something and we are publishing it. We are not analyzing somebody else's results. But from now on, comes the secondary literature, which is critically appraised individual articles. So somebody who is a expert in the field may take one article and critique it in the way, because critiquing also has a method to it. So that would be considered as secondary literature, but it would still rank higher. Critically appraised topics or guidelines, government guidelines, WHO guidelines, they come even higher, and final comes are systematic reviews, because they are then systematic reviews are done like all over the globe, like people, a new team is like surviving sepsis guidelines, which were published like in 2021 approximately. So if you see that those kind of guidelines, then the team who is producing those guidelines, they are like all over the world. You see some people from India, some from USA, some from Europe, some from Africa, some from Australia, and they it takes a lot of pains to create those guidelines. It takes years of hard work. So that is why it gets the highest. So that is filtered information, and this is unfiltered. Unfiltered is primary. Filtered is because it has passed through the experts. It is filtered. It is secondary evidence. Formulating the question, PICO format, you already know, patient, population and problem. Why am I talking about it? Because these 4 fields, the patient or problem versus intervention, comparison and outcome, these 4 fields will be used to perform the literature search. Okay, so if you see patient or problem is diabetic patients, daily aspirin if they take, versus standard of care, whether it reduces the cardiovascular event or not. We will look at one example so it will work. So now we know what are primary and secondary and what are scholarly sources. This particular image that you see in the background is a very famous image. It's a graphical representation of a very old quote that says all roads lead to Rome. Okay, so this is an actual image. It used to be like this, that all roads in the glory days of Rome led to Rome. So what is this here is PubMed. So when literature search is, as far as literature search is concerned, one of the commonest source where we do literature search from is PubMed, right? So any idea what is PubMed? Because what could have happened and what had happened with me is I would search for a topic on Google search, not even Google Scholar. I would search on Google search. But then few of the results that come, they would then lead me to PubMed. But I never knew fully what it is. So any idea what is PubMed? It's a database, okay? Yes, sir. Database of published articles, okay? Related to medical field, perfect. So let me clarify this, that it is a search interface. PubMed per se is not a database. It is a search interface. For example, consider I go on google.com and I type 7 wonders of the world. Forget the medicine for a while. 7 wonders of the world, right? So on the first page there are like 5 or 10 or 15 results that pop up. 7 wonders of the world. Those results lead me to other websites, but those results are not owned by Google. So the way google.com is a search interface to explore the web, the same way PubMed is a search interface to explore something known as Medline, and that Medline is the database. Okay. Now, why is Medline so popular, or rather most searched is, so it's a free search interface for Medline. What is Medline? It is a collection of either abstracts or some of the full text also, right? But PubMed per se never provides full text. It only provides links to the full text. National Library of Medicine, so National Institute of Health owns National Library of Medicine, which then owns Medline, which then owns PubMed. So there are no full text articles, only links, and it is a search interface. Okay. So if Medline is such a great database that I want to search in, there are two ways how you can search it. One is PubMed, which is free, but then there are other companies. Elsevier also has its own, Science Direct also, EBSCO, Ovid. These are also other search interfaces which also search Medline only, but they are paid. So for all practical purpose, we will be talking about PubMed. So far are we clear? We are going to now, I will demo how to search on PubMed. But before we do that, I want you to remember 7 things. Okay, 7. So if you want to be more effective in searching in PubMed, you need to know the strategies of searching in PubMed. So few basics. So there are 4 Boolean operators. Okay. So you see there are 4. I would say that 4 strategies. The first strategy, just remember the name for a while, Boolean operator. The second part is nesting. There's something known as truncation, and then there is something known as quotes. 1, 2, 3, 4. These would then be followed by filters, field tags, and mesh terms. 7. In a while, everything will be clear. Just stay with me. So what are Boolean operators? So consider you go on google.com and you see that you want to purchase a new mobile phone, but you want to purchase a new mobile phone under 25,000 rupees. So what do we do? Mobile under 25,000 rupees. We just write that thing down, right? Consider you don't write 25,000 rupees, you write mobile. Then it will bring far more number of results. Now when you say 25,000, it will lessen the results. So which means that when you want to search diabetes mellitus and hypertension, if I search diabetes mellitus only, it will bring more results. If I add and, which means it will only bring me the articles which has diabetes mellitus and hypertension. So and is considered one connector. It is actually known as Boolean operator. So why it is known as Boolean is there was someone known as George Boole who was the father of Boolean algebra, and Boolean algebra is frequently used in software development even today. I mean, every single software has this algorithm. So and it will bring records that has both diabetes mellitus and hypertension. So these are all the articles with diabetes mellitus, these are all with hypertension. If you search with and, it will bring only these many. So it actually narrows your search, or will bring both, whether it is diabetes mellitus or hypertension. If you find any of this, just bring me the result. Not will exclude. So I want diabetes mellitus only, but there should not be any hypertension topics in that. So it excludes. So first part is Boolean operator. Second part is nesting. What happens is, now when I am saying all this, what I mean is, when you go to PubMed, which I will demonstrate, when you go to PubMed, there is a search bar. The way you go to google.com, there is a search bar in which we type. The same way, when you go to PubMed, there is a search bar in which you want to type. So these are the strategies that are to be used when typing something in that search bar. Okay? So first was Boolean operators, second was nesting. What is nesting is that, consider you want to search for the same diabetes mellitus and hypertension. But you do feel that there will be some articles where they may write high blood pressure instead of hypertension. So you don't want to miss out on those articles. So you want it to know that you want to search for diabetes mellitus and high blood pressure or hypertension. Bring me all of those articles. So in that case, what you would do is you would use hypertension and high blood pressure inside a parenthesis, in which case it would just search one thing. So if you see this example, DM and hypertension or high blood pressure, this will not bring you the correct result, because the way it works is that it will consider both of these and these. So it will bring all of this. But if you apply this parenthesis here, then what it will do is it will bring diabetes and hypertension and diabetes and high blood pressure, right? So parenthesis, so it's a parenthesis inside of which you can put all the similar meaning terms, so that whatever is used out of them, it will bring out the results. Truncation is shortening, right? Truncation means to shorten something. So consider you want to search for childhood diabetes mellitus, but it may be childhood diabetes mellitus, diabetes in children, or children with diabetes mellitus. So you know that in giving out the age criteria, child is the root term. So if you just type child with an asterisk, it will bring child, children and childhood, right? Because the root term is the same. And because you have applied a truncation, it will understand that I need to bring all the words which has child as the first 5 letters, right? So this is known as truncation. Quotation mark, in the earlier example you saw that when you write high blood pressure, you wanted to know high blood pressure as a single word, not high and blood pressure as 2 different terms. So in which case you use quotation marks, so that it understands it to be a common single word. To search for phrases, PubMed will then search for exact that multi-phrase. So without quotation mark, high blood pressure will be searched at high and blood pressure, but otherwise it would be searched as high blood pressure. Now what are mesh terms? So I told you that you will have to remember 7 things, out of which 4 I told you. Boolean operator and or not. Then quotation, truncation and nesting. 4 things. Now comes 3 more terms.
Truncation is putting asterisks.
Asterisks, yes. So if you see that there is a root term which is common, then you just use those 3 or 4 alphabets, then put a truncation, so it will take care of the rest. Now mesh terms. So if we go back, I told you that why is Medline the most searched medical database rather than Google Scholar or anything, is because of mesh terms. Okay, so in 2 minutes I will just try to explain what they are. So mesh, MESH, stands for medical subject headings. ME is actually short, so ME and then SH, medical subject headings. So consider, for example, that I am a library or a journal keeper. I am an article keeper. Okay. Now consider there I get 100 articles. Someone comes and gives me 100 articles, and he tells me that, you know what, you go through all the articles, but the moment I ask you for one, you immediately pop out that relevant article to me. Am I making sense? Consider I am a library or a journal keeper, and someone gives me 100 articles and tells me, okay, you know what, you go through all articles, you keep it the way you want, but the moment I ask you for articles, you want to bring them out just like this. So I get 100 articles of various subjects, but I need to be sure that when someone asks for hypertension, I need to bring these 2 articles out. When someone asks for pregnancy in hypertension, then I need to bring these 2 out. Somebody asks for tuberculosis, I need to bring these 2 out. Then what would I do? So one of the common thing is I would catalog them. Even if you go to any store, just go to a apparel store or anything, they have everything cataloged. Like if you ask them to I want this particular dress or this particular thing, then they would exactly know that it's lying right there, right? So what I would do is I would first start to catalog them. How can I catalog them? So I would see that, what year they were published, who are the author, what's the name, what's the title of the article, etc. Right? Am I clear so far? But then there is something else that I will do, and that is what Medline actually does, which makes it stand out. So what they do is, when one article is submitted to Medline, there are experts who are sitting there, and then they would go through the article. Once they go through the article of 5 or 6 pages, they will decide by themselves that what does this article largely talks about. Forget about the title only. What does it actually talk about? Giving you an example. Consider there is an article on diabetes mellitus. But when I read that article, those 5 pages, I came to know that they are also talking about cardiac risk or risk of ischemia and hypertension in this article. So what I would do is that not just that when someone searches for diabetes mellitus, I want to bring this article, but even when someone searches for ischemic myocardial infarction risk, or someone talks of hypertension, I believe that even though these 2 things are not there in the title, I need to get this article to that person. So when I wrote that this article talks about diabetes mellitus, hypertension and ischemic heart disease, those are known as mesh terms for that particular article. Did I make it clear? So each article is read by experts and about 5 to 10 mesh terms are applied to each article. So you can imagine it's a repository of about 30 million articles. Medline is a repository of about 30 million articles and they have been indexing it since late 1800s. So about 150 years now. They have been meticulously, every article that is brought, it is read, some mesh terms are applied and it is catalogued. So that now when you go to search and apply certain mesh terms, which how to do I'll tell you, you get far more accurate results than you would otherwise, especially if you would search on Scholar. So are you clear about the mesh terms, medical subject headings? 7 or 8 terms or 10 terms, which are those are also not vague terms. There are 25,000 mesh terms which has already been defined. Okay. So it stands for medical subject headings. It's a standardized thesaurus, hierarchical thesaurus. So when I say hierarchical, it is like our textbook. You go to textbook, what's the first thing? Like you take anatomy textbook. What's the index like? That it's upper limb. Then upper limb, then there are further 2 subjects like forearm and arm and hand. And then in hand there are like fingers and palm. So it's hierarchical. Subject analyst examines each article and maybe 10 or 12 per citation mesh terms are given. Over 25,000 descriptors are there. Mesh terms clear dekhi because that is the thing about PubMed. Okay. Now there are something known as field tags. Field tags are, I want to talk about diabetes and hypertension, but I want that they should be there in the title of the article, not only in the mesh term. I want articles which talk about diabetes and hypertension in the title. So then I would apply field tags. They are like code in brackets. So consider when I search for a particular term and if I write besides them TI like this, then what PubMed will understand is Ravi wants to know about diabetes and hypertension, but these 2 terms should be in the title, not in the mesh term. Not only in the mesh term, it should be in the title. The same way if I want them to be in title and abstract, I can write this and it can just be a blank text word, which means this TW is a default if you don't write anything, that if it appears anywhere, right? There are many field tags, but I just demonstrated few. So there are a large list of field tags. I mean, I will share all of this, that's okay. But we will commonly use title. If you want to know about a particular author, there can be author field tags and then there can be mesh terms, etc. Then there are filters. Filters are very common. You go to any e-commerce websites and on left side you have filters. Atli price range ma apjo, a brand nu apjo, etc, etc. So filters are same as on e-commerce apps, and left side it can be date, article type, it can be how old, etc. There are many newer platforms that we can talk about, but let's first go on with the demo. Okay, everyone, we talked about literature search, in which we saw the sources, and then I told you that we would be mainly talking about how to search on PubMed, whereby there were 7 things: Boolean operators, nesting, quotes, truncation, then we saw mesh words, then we saw field tags, and finally filters. 7 things, right? So right now I will demo how to, using probably each one of those 7 strategies, and then I will give you a couple of examples to practice on. Okay, so fine. So as with everything, the way you start is you go on any search engine, you search for PubMed. Usually the first result would be PubMed. So this is what the homepage of PubMed looks like, right? So the way google.com is a very clean interface, no clutter. This also has a clean interface. There's just one search bar whereby you type what you want to type. So consider I want to search for the same topic of diabetes mellitus and hypertension. Okay, so in this search bar, I'm not even right now using any truncation. I'm not using mesh terms. I'm just searching like a newbie, diabetes mellitus and hypertension. So I would type diabetes mellitus and hypertension, and I would hit enter. Now when I do this, you can see just a sec. Okay, so you can see that it has almost 83,000 results. Can you see this? 83,000 results, right? So the various types of articles it has come up with are vitamin C for type 2 diabetes mellitus and hypertension, crown preparation in a patient with hypertension and type 2 diabetes mellitus, essential hypertension and diabetes mellitus. Now what I want to demo here is, consider that I had not used any mesh term anywhere. I just searched keywords. Keywords means normal terms. I did not apply any field tags that I want to go with mesh term or anything. But what happened is, PubMed, when it read diabetes mellitus and hypertension, by itself created an entire search string. What is a search string? Search string means what you write in the search box. And then it brought us these 83,000 results. So in order to see what PubMed did to this in the background, you are not seeing it here, but in the background, what I would do is I would click on this advanced. Now when I do this, I can go down and you can see history and search results. Can you see this? History and search details, which means that today in this session, whatever I search for, it will keep a record of that search. So soon I will demo some other examples. So it will keep on stacking all of them. So right now in this session, I have just searched for diabetes mellitus and hypertension. What I do is I go to these 3 buttons and, sorry, just a sec. Yeah, I click on this detail. Now you can see this. Okay, I'm keeping this in the center. Now try to understand this. What it did is, I just wrote that diabetes mellitus and hypertension, but the entire search string it created is this long. So what has it done? It has used, can you see this first parenthesis? This first one, is it visible? Yeah. So in parenthesis it wrote diabetes mellitus, but in diabetes mellitus it used quotes, which means it used it as a single term. And because diabetes mellitus, it searched for diabetes mellitus in mesh terms. Then it created an or diabetes in any field and mellitus in any field. So this was the second option. So diabetes mellitus it created, then it thought that okay, diabetes in any field or mellitus in any field. I will search for that also. And then finally here you see that first quotation being ending. This quote ends here. Now end. So this much part it is just taking care of the first 2 words that I asked it to search, which were diabetes mellitus. Okay. Now it said that end Now here comes, you know, the longer string. Hypertense in all fields, or hypertension in all mesh terms, or hypertension in all fields, or hypertension and then space and S, or hypertensions, or hypertensive and S, or hypertensives. Can you see all of these words? So this up to here is what PubMed interpreted the single word hypertension as. And then it ran this query on its database and gave you the result. So this was background. Now you can do this in the foreground by using the same Boolean operators, truncation and quotes directly on the search field. Am I making sense or am not making sense? So this is what it did to your simple search of diabetes mellitus and hypertension, all in lowercase. Now let's again go to PubMed. And I'm now writing diabetes mellitus, but I want exactly diabetes mellitus. So what I would do is I would use quotations. Okay? देखाई छे के I'll enlarge it a bit. Yeah? Diabetes mellitus. So I wanted to treat it as a single word. So I made it into inverted commas. Now, I also think that maybe there may be some articles where they may call it DM type 2. Or they may call it type 2 diabetes mellitus. So they are also the words that may be used in some articles. And I don't want PubMed to miss out on those articles. So what I do is I write or, and then I write type 2 diabetes, type 2 diabetes, and then I finish the quotes. But then I'm sure that it can also be known as T2DM. So at 3 places I have used quotes, and I am sure that I want either of this. So which means that this first diabetes part I need to put it all inside of a brackets, which is known as nesting. So I will go at the front of this, and then I will put one bracket here and one in the last. So this is first part. I enter some space, I add some space, I write end. And now begins our work for hypertension. So as with the previous query, I can write hypertension, hypertensives, high blood pressure. So hypertension and hypertensive, we can truncate it because they both come under, they both have similar root. So I will begin another nesting. I will write hypertension, but I can also write tensive. So I will put an asterisk here. So now this will bring hypertension and hypertensive. Whatever is written somewhere is what it will bring. Now કદાચ આવી શકે બીજું કંઈ, એટલે we want to go as long as possible. 8th. So hypertension, and then there can also be, as I told you, high blood pressure. And I will complete this, and I will end this nesting. Yeah, we can also add high blood pressure. Good, I like involvement. High BP. You want to keep it simple? HTN, you want to use HTN. Hypertension is commonly used, so we can do that as well, no worries. Or HTN, I'll write it in capital, okay? And I will complete this nesting, okay? And now we hit search. So the results are still 75,000. The point is, now if I go to advanced, now if I go to advanced, I showed you in the earlier example, we went to advanced. I told you that it will record all your history for today's search until you delete it. And in that we went in detail and I showed you the search string that PubMed created on its own. Here we have created that search string instead of PubMed by use of truncation and nesting and parenthesis and Boolean operators. So let us go to advanced and let us see what has PubMed done to this particular search request. So we go down, details. Now can you see the difference between the length of both search strings right now? This is what we did. Okay, so you can see this. Yeah, you can see this was the original one, which was way long. This is precise. Now because we did not specify field tags, so we did not ask it that we want these field tags of somewhere in title only or TIAB, which means abstract also, or anywhere else. So then it applied field tags at every search term as all fields. So wherever these terms are appearing. So you can see that diabetes mellitus, all fields, type 2 diabetes mellitus, all fields, T2DM, all fields, hypertension with asterisk, all fields. So essentially it has not changed much of our search string except applying field tags. Whereas if you see this example, it had to do the hard work which we did for this example. Okay, so now we go back to the results.
So I don't know for put it.
6000 નો ફરક પડ્યો, સાચી વાત છે. Okay, so now so that was about the now let us see for any one article where can I see the mesh terms for that article. So consider I am in this result and I feel that this first result of diagnostic and prognostic value of triglyceride glucose index comprehensive evaluation of meta-analysis. I will click on it. So what will happen is PubMed will now bring the listing of that article in its search. It will not give you full text. It will give you link to the full text. Also it will give you some abstract, but there are other things that it will give you. So this is what it looks like. Simple. So this is the title and the authors, the PubMed ID, PubMed Central ID if it is. There are few things here. There is abstract, right? This is the abstract. And then there are some other things. So let us see what they are. So on this right side, these are the links to the full article. Now the links to the full article are not, it does not differentiate whether it is available free or not. It just provides you the link. Then if it is free, then free. If it is paid, then so. But if you go down on this right side, there is title and author and abstract and conflict of interest and figures. I will zoom it a bit. Yeah. There is a choice, there is an option of similar articles cited by, which means who all have cited this article, references, publication type, but then comes the mesh terms. Can you see this? So if I click on this mesh term, what I come to know is I will come to know all the mesh terms which are attached to this article. I told you earlier that each article that my Medline receives, experts go through it, they attach approximately 10 to 12 mesh terms to it. Those mesh terms are hierarchical, they are pre-existing. 25,000 odd mesh terms are there. If I am to given one article and to attach mesh term to, then I just can choose from them. I cannot create another one from my mind, right? So they want to say that this article, if somebody searches for adult or aged or biomarker or blood glucose or diabetes mellitus type 2 blood or diagnosis or epidemiology or female or humans or male or middle-aged, any of these, if somebody searches, then this article would show up. That is what mesh term is. Did I make it clear? these are the terms applied to this article. So if somebody even if is searching for middle-aged anything, then this article would show up. Now it may not show up on the front page in the first result, but somewhere maybe 70,000, 75,000 it may show up, right? Okay. Now there is another strategy to create the search string.
આજે 80,000 છે
હા સાહેબ,
એમાં priority કેટલી છે?
એ છે ને સાહેબ અહીંયા છે sorted by. So we go to the search result. Now this is sort by. Okay, so this is sort by. Now you can sort by many things. Most recent publication, first author journal. Best match when they say, so they are probably running an algorithm which takes into account the citation factor of that particular journal, author, and how relevant the topic is, etc. Yeah, so now
One more question.
yes sir.
મારો આર્ટિકલ છે PubMedમાં સાહેબે સર્ચ કર્યું તો મારું સાઇટેશનમાં આવે ના એ મારો આર્ટિકલ ઓપન કર્યો તો જ આવે.
ના એટલે સાહેબ ધારો કે તમારો આર્ટિકલ જે છે ને એ જો મેડલાઇનમાં
બજારમાં છે
હા તો એ હા
PubMedમાં ખોલ્યો ને એટલે PubMedમાં આ બધું ઘણા ખોલતા એમાં આવ્યો તો એ સાઇટેશન ના કરે આર્ટિકલ ખોલે ને વાંચે તો
ના 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 ના, એ તો જે આખો ફૂલ ટેક્સ્ટ આર્ટિકલ ડાઉનલોડ થાય એ જ ગણાય સાહેબ.
ડાઉનલોડ કે ખાલી
ડાઉનલોડ નહીં, એ પછી એને સાઇટ બી એને કરવો પડે. કોઈ બીજા કોઈએ પોતાના સ્ટડીમાં સાઇટ કરે તો જ ગણાય છે.
એમાં શું છે આર્ટિકલ લખાય ને તમારો આર્ટિકલ એના રેફરન્સમાં લખે અને એ આર્ટિકલ અપલોડ કરે ને તો એ તમારું છે.
બસ એ રીતે બરોબર સાહેબ. ઓકે સો okay, so far I told you two things. One is searching by keywords. You just write down whatever is on your mind, whatever 2-3 main things of your study, 2-3 main points of your study. Second is you can think about that how to create a search string by using Boolean operators, right? But there is a third method which I will demonstrate now. So again, what you do is you go to PubMed. Now in PubMed, in the lower part of the page, can you see this explore button? And in the the top clickable name is something known as mesh database. This. So what you do is you click on mesh database. Okay, it opens up a page like this. It opens up a page like this. Okay. Now this is not PubMed. Okay, a mesh database. This is a different website. This is no more PubMed. So you are no more in PubMed right now. You are in mesh database right now. Okay, yes. So it again has the same search field, the way Google and the way PubMed has a search field. There is a search field, you can hit search. But then there are these options that you want to search what? Like an advanced search on Google or something. Maybe you can drop down, you can see the drop down. And it shows something like this. When you click on it, you can search all database, you can see some other database like clinical variants, a genomic database, PubMed Central, etc., etc., right? What you want to do is, because we are right now searching for PubMed, we will keep this first field as mesh. So now I want to search for cholecystectomy complications. Cholecystectomy complications. Okay? So what I would do is I would first add cholecystectomy, because cholecystectomy is my main complications, the second thing, and then I will refine it. But let us, for example, right now I want to search for cholecystectomy complication. So I would write cholecystectomy, okay, and Yeah, I know. Okay, and I would hit search. When you do that, it opens up these 3 results for you. First result is cholecystectomy, second is cholecystectomy, laparoscopic, and third term is post-cholecystectomy syndrome. So related to cholecystectomy, there are 3 mesh terms. Related to cholecystectomy, there are 3 mesh terms. So consider I click on this first one, cholecystectomy. And after I do that, you want to go down. So if I scroll down, you can see the entire hierarchy, how cholecystectomy is stored. So can you see this hierarchy? That consider cholecystectomy at this point is all mesh categories, the main grand tree, the main root of the tree, of which there is another one branch called analytical, diagnostic and therapeutic techniques and equipment category, of which there is something known as surgical procedure operative. In surgical procedure operative, there are digestive system surgical procedures. In digestive system surgical procedures, there are biliary tract surgical procedures. And in biliary tract surgical procedures, there is cholecystectomy. Okay? Now, consider that I want to broaden my category of whatever my study is, then I may choose biliary tract surgical procedure. I can go up. Or if I want to get more specific, there is one further mesh term available, which is laparoscopic cholecystectomy. Is this making sense, the hierarchical structure? So this is so for all 25,000 words, 25,000 terms, right? So what I do is, I then change my mind that I want to study complications only, but let me go for laparoscopic cholecystectomy. So I click on this, laparoscopic cholecystectomy. What did it do? So it changed this heading, and what I now do is, I want to add this term in search builder. So you can see this on my right side. On the right side of the screen, this is the left side, and to the right side there is this something known as PubMed search builder. So if I click on add to search builder, it will add this mesh term into the search builder. So I will show you, add to search builder. So you can see this automatically popped up. Cholecystectomy, laparoscopic, it is already into inverted commas, and they want to search it into mesh term. Okay? Fine. Now I want to see, consider that one particular complication I want to search for is biliary injuries. In laparoscopic cholecystectomy, biliary injuries. So what I do is, I again go back to this is on the same web page, mesh is already selected, and I write biliary injury, and I hit search. So you can see that there is a lot of results about injury, but there is nothing like biliary injury here. So that means I may be making some mistake in the terminology. So it is saying that no mesh term was found in biliary. So what I would do is, I would write bile duct injury. Okay? Bile duct injury, and I would hit search, because it is not a mesh term. So what I would do is, hip post cholecystectomy complications. It is not a mesh term again. Let us write complications. Bane. So now when I wrote complications, complication is a mesh term. So what I do is, I click this first one. What I do is, I click this first one, and now I am clear that I want to search for laparoscopic cholecystectomy and complications. So if you see to the right in the search builder, that earlier selection is already there. Can you see? It's already there. It has not gone anywhere. I was in the same window. It has not gone anywhere. It is still there. So what I would do is I want to add this complication, this subheading, and I want to use and between them. So I will keep it like this. I would add to search builder. So now it is cholecystectomy laparoscopic as a mesh term and complication as a subheading. Right? Now consider that I want to exclude wound infection. I don't want wound infection in this results. So what I would do is wound infection as the search. So this is the wound infection that came as the first result. I want to add this to the search builder, but I want to say that not wound infection. So laparoscopic cholecystectomy, complications, but not wound infections. So I would select as not, and then I would say add to search builder. So this is how the entire search string gets built. And now there is this option of searching it where? On the PubMed. So this again, this is not PubMed. So when I hit on search, it will lead us to PubMed. And it will start searching with this search string. So I have just clicked on search on PubMed. And you can see 2000 results, the same string that we created. Right? And now if you select maybe this article, abdominal pain syndrome, and you see the mesh terms, it would have all those mesh terms. Cholecystectomy, laparoscopic. Complication is a subheading, so it is not in the mesh. And not wound healing. So this will not have wound infection, not wound healing, wound infection, right? And the last part is, of course, the filters, which are, you can choose the publication here, whether it's abstract, full text, whether it's books or clinical trial, meta-analysis, randomized trials, whatever. I mean, whatever you want. And another thing I would demonstrate is, if you want laparoscopic cholecystectomy, but not in the mesh term, but in the title. So what I would do is laparoscopic cholecystectomy, then put brackets, write TI, which is a field tag for title. And now if I search, can you see all of these have titles as laparoscopic cholecystectomy, all articles, right? And if I write TIAB, which means title and abstract, and if I search, so these results would have laparoscopic cholecystectomy either in the title or in the abstract. Both will come, right? You can of course titrate the publication year, types, all the filters as are available in most e-commerce websites. So does it make it clear? If not very clear, then at least to some degree, that how to search on PubMed. 7 things I told you: Boolean operators, and, or, not, and then nesting, and then truncation, and quotations, which is quotation marks, and then 3 other things which are mesh headings, field tags, and filters. Filters are always the last because you apply them once you get the results.